So, good evening, folks. Today I want to talk a few minutes about measles. Measles is an acute, highly infectious disease characterized by fever, respiratory symptoms, complex spots, and a maculopapular rash. Measles virus is a highly contagious virus. It's a spherical, single-stranded, enveloped RNA virus that belongs to Paramyxoviridae family. The virus gains access to our body through the respiratory tract and is transmitted primarily by respiratory droplets. And it is endemic throughout the world. Now, symptoms and signs, I will go through steps. The first one is incubation period. The incubation period for measles is 10 days to fever and 14 days to rash. After the incubation period comes prodromal phase. In prodromal phase, patients develop cough, coryza, conjunctivitis, and high-grade fever. And what in the world is coryza? Coryza basically means nasal obstruction, sneezing, sore throat, and upper respiratory infections. Patients also develop complex spots. So complex spots, they come before the rash in the prodromal phase. They are pathognomonic of measles. Basically, they occur 2 days before the rash and they disappear in 72 hours. They come as like grains of sand. They look like tiny white specks surrounded by red regions. So complex spots, they come opposite the molar teeth or even in vaginal mucosa. So complex spots, they are described as grains of sand or even table salt crystals. When you see that, that is measles. Then they develop the rash. This is a maculopapular rash. It starts on the face behind the ears and it progresses downwards and outward over the extremities, including the palms and soles. So when you see this facial rash going down, and you always think about measles. Patients are contagious during the prodromal phase and the first 2 to 5 days of rash. If the patient is in the hospital, you should isolate them with respiratory precautions. And if they are outside, still when they are contagious, you need to take precautions around them. The diagnosis, usually clinical features, the characteristic fever, cough, coryza, conjunctivitis, and then complex spots, maculopapular rash. When you see them, you should think about measles. If you do labs, you will see leukopenia, thrombocytopenia, proteinuria, and positive serum immunoglobulin, that is IgM antibody, it confirms the diagnosis. Treatment, basically you give Tylenol, ibuprofen, and you need to control the fever, and then you need to give them lots of fluids. In children, vitamin A supplementation, it reduces morbidity and mortality. So vitamin A treatment is important in measles in children. And antivirals like ribavirin are also helpful. And some patients develop serious complications like otitis media, encephalitis, pneumonia, and bleeding disorders. So you need to keep a close eye on these patients. And infection confers lifelong immunity. The prevention vaccination, there are 2 doses of vaccine. You need to give 2 doses of vaccine and they have like 97% protection. In children, you give 2 vaccines and the first dose is at 12 to 15 months and the second dose at 4 to 6 years of age. And in adults born after 1957, you should give 1 dose of MMR vaccine. Now, there is some controversy about MMR vaccine and autism. Like I heard patients telling me actually in person that they developed this children developing autism after this vaccine, and these are very painful stories. But you say MMR vaccine, there is no evidence to blame MMR vaccine for the autism. In fact, for decades we blamed thimerosal in MMR vaccine for autism. Then they stopped even putting thimerosal in this vaccine. But you say, after stopping thimerosal, the autism is going. The rate of autism in society only went up. So what does it tell you? Thimerosal has nothing to do with autism. There must be other factors. So there is something called correlation versus causation. Okay, so when thimerosal is there, we always blamed it. Thimerosal, it is causing autism, autism, autism. And we stopped it, and still the autism did not go up. So we should stop blaming thimerosal for autism. And overall, it's a good vaccine, and highly, highly recommend giving MMR vaccine to everybody. And there are genuine contraindications. Like, for example, this vaccine is contraindicated in pregnant women, in women who are intending to become pregnant in the next 28 days. Immunocompromised patients should not take this thing, and persons who develop anaphylactic reactions or to vaccine components like gelatin and neomycin should not take this vaccine. And also children receiving high dose corticosteroid therapy should not take this vaccine. So that is briefly about MMR and vaccination. And if you have more questions, please come to visit us or call us for an appointment. Our phone number 814-424-2095. Thank you so much. Have a good day.